Myself, Dr. Mohammad Asif, S. Consultant and Interventional Cardiologist from Olive Hospital, Mehedipatnam, Hyderabad. So today I will be talking about how can we prevent an heart attack. So as I discussed previously, again here few important points which we have to remember. How can we prevent an heart attack? Suppose somebody can ask me that I am 40 years male, healthy, I don't have any risk factors, I don't have any habits, and I don't have any comorbidities, diabetes or hypertension. So still I can develop heart attack? Yes, the possibility is yes. So how can we prevent that again? So remember this, the few things which you have to remember, that the lack of physical activity itself is a big risk factor for developing a heart attack. So any person who is not doing a physical activity regularly, he is at the risk. So let us discuss few important points today, how we can prevent a heart attack and what are those important points. One is eat a healthy diet. Healthy diet, a balanced diet is very, very important. It's just not munching and whatever you get it. Okay. So this should include your food from morning to evening 24 hours. You should plan your food accordingly. Should have a good amount of vegetables, good amount of fruits, especially seasonal fruits, whole grains, lean meat, fish, pulses with restricted salt. This is a classical diet which is recommended for the healthy diet, and reduce salt intake of sugar, reduce salt, reduce sugar, then alcohol consumption also be stopped. Second thing is take a regular physical activity. This is most important thing, at least a 30 minutes per day. You don't have to run, you don't have to hit gym for everything. What you do is do a regular walking, brisk walking for 30 minutes per day, weekly 3 to 4 days. Any time is fine. Either you take a daytime, in the night time, whichever time you are comfortable, but at least you should be able to do it. Then third, you are smoking, which is a dangerous killer of the heart. What happens is whenever the smoking is there, the nicotine, which damages the endothelium, leading to the atherosclerotic process very fast and increasing the risk of heart attack. So it's better you stop it. Fourth is check and control your overall cardiovascular risk factors. Like if you are a diabetic, it is advised to control your sugars regularly. Visit your doctor regularly and get your sugars under check. If this is not done, over the span of 3 to 4 years, slowly the endothelium will get damage of the vessels and leading to the increased risk of atherosclerosis, and there is increased risk of heart attack and stroke. And those who are hypertensive, again for them also it is recommended that their blood pressure should be well controlled. Suppose the BP is not controlled and the BP shoots up intermittently, there are very high chances the pressure on the heart also increases. So heart has to pump against the resistance developed by the hypertension. So it is very important for us to control the blood pressure adequately to prevent any of the cardiac diseases. So again know your lipids. This is very important. Suppose your age is more than 30 years, it is advisable get once at least your lipid profile done. Look at your cholesterols. What is your level of LDL? What is your level of triglyceride? What is your level of total cholesterol? If they are elevated, this is the time you should act and at least get your cholesterol checked at least yearly once. If it is elevated, better to consult a cardiologist and start a treatment for that. And in your diet, try to reduce the intake of the fat. So it should be a low fat. Then, so the overall, how can we prevent a heart attack is that by leading a healthy lifestyle, a physical activity, eating a food rich in fruits and vegetables, avoiding tobacco, avoiding alcohol, okay, and for having a proper sleep. If you are diabetic and hypertensive, control your blood pressure properly, control your sugars properly. So by this, you can definitely prevent a heart attack to maximum extent. And any issues or any symptoms if you develop, it's better to visit your doctor nearby. Thank you very much.